Hey team, it's Dr. George here, and today I wanted to talk genital warts. I've seen a few patients this week who have had warts around and inside the bum, and they're quite concerned, as like, am I stuck with this forever? Or, yeah, I understand the concern. Warts are yucky, they're annoying, they're itchy, and they can bleed, and we're always alert for bleeding around the bum. So warts are made by a virus, and that virus is HPV, or the Human Papillomavirus. There are hundreds of variations of that particular virus, so it's difficult to know exactly which strain you may have been infected with. In most cases, within 18 months, your body will create an immune response against the wart virus and they will go away. However, if you want to get rid of them faster, there are treatments available, and this can include freezing them, which makes the cells break down and your body will present those broken down virus particles to the immune system, and that will encourage the production of antibodies. But there are also creams that can be used that modulate and encourage the immune system to get rid of them. They can be a little bit uncomfortable in treatment, but it's worth doing and talk with your doctor about. Now, the thing about warts though is that they are a warning, because later in life, we know that men who have sex with men are at 40 times the risk of developing anal cancer. Now, anal cancer is also highly associated and caused by the HPV virus. In Australia, and perhaps other parts of the world, we decided to vaccinate women against HPV because we knew that it was associated with cervical cancer, but men were not vaccinated. However, this is a really bad thing because we've left out half of the population. So men who have sex with men, HPV can cause anal cancer. For our straight counterparts, that can cause head and neck cancer in the tonsils, in the throat. So it is worth vaccinating men against HPV. There is a vaccine called Gardasil, which protects against 9 strains of the HPV virus, 7 of the nasties, and 2 of the annoyings. All my gay patients, I always recommend, please consider getting the Gardasil vaccine. It's a series of 3 injections that will give you lifelong protection. If you are living with HIV, it is very important that you consider getting this vaccine, because that risk of actually increases to 100 times the risk of developing anal cancer later in life. And that is higher than breast cancer, higher than colon cancer, and higher than prostate cancer. So please talk with your doctor. If you have warts, please don't be embarrassed, don't be ashamed. Go to your doctor and you can get the treatment. While you're there, have a talk about vaccines, in particular Gardasil, which will help protect you against the nasty strains of HPV. Happy to answer any questions below. I would really appreciate it if you could like, if you could share, and if you could follow along to help the algorithm do its thing. Anyway, stay safe, stay healthy, and I'm always happy to answer any questions. Have an amazing day.